I'm Dr. Tracy Stecker, and welcome to the Choosing Help podcast. Choosing Help presents conversations about courage, connection, and the transformative power of asking for support. Through candid discussions, expert insights, and real-world stories, this podcast breaks down stigma and opens doors to understanding. Join our community committed to compassion and courage, because when we choose help, we choose life. Welcome to Choosing Help. I am Dr. Tracy Stecker, and I'm here today joined by Dr. Nicholas Allen, and we're going to talk about anxiety. Um, Fear and anxiety closely related. Fear is a natural response. All of us have experienced fear before. It's the body's response to danger cues, and a very normal, natural thing to have the body respond to danger cues. It's a signal that you might need to seek safety in some form or fashion. Anxiety is different from that. It's related to that, though. It's a response to fear. So anxiety develops as after people have experienced fear. They begin to dread that feeling of fear or dread those circumstances where they might have felt fear. Some individuals really like the feeling of fear. It's adrenaline to them. They might seek out circumstances where they could feel that again. Other people did not like those sensations at all, and they really don't seek out those circumstances again. And then there's other people who very much did not like those sensations and develop more of a chronic level of anxiety. They don't even like those sensations at all. And so might naturally avoid anything that could lead them to feeling that discomfort again. I'm not going to articulate it as well as Dr. Allen, so I'm going to hand it over to him, introduce him first. Dr. Allen is a psychologist and he's a researcher at Ohio State University, and he's at the Center of Excellence for Suicide Prevention in VA. His areas of expertise are anxiety disorders, substance use disorders, and suicide. He's also a very good statistician. And I'm gonna hand it over to you, Dr. Allen. Could you give us a little bit of information about anxiety?
Sure, I would love to. Before I start, though, I do have to say that I'm contractually obligated to let you know that it
Oh,
is
no.
the Ohio State University. Um,
Thank you for
so
clarifying.
you're welcome. But when I talk about anxiety sensitivity, I like to start actually where you start thinking about the body's alarm system. So the example I like to use a lot of time with patients is you picture yourself walking in the woods and suddenly you come across this bear. You know, your heart's going to start racing, your breathing's going to pick up, muscles are going to start tightening. And that alarm response is exactly what you want in that situation. You know, it's going to prepare you to fight, flight, or freeze. And for some people, though, our alarm system is really oversensitive. And so instead of a bear in the woods, the trigger might be giving a speech, meeting someone new, or even hypothetically being interviewed on a podcast. The body reacts in the same way, but the sensations get interpreted as dangerous. And so a racing heart feels like you're going to have a heart attack. A little dizziness feels like you might pass out or lose control. And so that fear of those bodily sensations themselves, that's what we call anxiety sensitivity. And when someone starts catastrophically misreading their own bodily cues, they begin avoiding anything that might even produce them. And that can include things like exercise, even. And so over time, that avoidance really just narrows down their world in ways that really interfere with work, with relationships, and with daily functioning. And so it becomes that it's not just that anxiety and that fear itself. It's really those feelings that come along with it that start to trigger anxiety. And so you get into this vicious cycle.
Yeah, so it's a natural reaction to danger, and you appropriately think, I need to get myself to safety, regardless of the context. However, some people, their thoughts spread into all sorts of different circumstances and situations. And that's what gets confusing because they're not entirely sure when they're in danger or when they're not in danger, but their body signals are producing that same effect. And and they almost, it sounds like freeze or have an inability to decide what to do next.
Yeah, I mean they could freeze. They could actually choose similar strategies. So it could even be flight, maybe but actually maybe what happens even more often is they turn to avoidance. They just,
Mhm.
try to not engage in things that are going to cause them even sensations similar to anxiety. That's why I mentioned exercise earlier.
Mhm.
In fact, it's interesting. There's some evidence that kind of getting people to engage in exercise can actually help reduce anxiety sensitivity.
Oh, that sounds interesting. Well, it's a great segue too to my first question, which is what what are good treatments for people who are sensitive to those sensations of anxiety and fear?
Excellent question. So, we do have some effective treatments out there for anxiety sensitivity. Like I talked about, there is some evidence that kind of brief exercise programs can be helpful. But in addition to that, there are some cognitive behavioral therapy approaches that we use. And one of them is a technique from that's often used treating people with panic disorder. And so in this technique, it's called interoceptive exposure. What we do is we help people deliberately bring on the sensations that they fear. So deliberately bring on a racing heart or shortness of breath, and then helping teach them that these sensations, while uncomfortable and not particularly pleasant, they're not dangerous. And so in a sense, what we're doing is kind of helping them recalibrate that body's alarm system. Um, oh, and to follow up with that, so a lot of my own work is really looking at these internal sensations and how they influence anxiety, suicide risk, substance use, and help seeking. So we consistently find that people reduce their fear, or when people reduce their fear of these bodily sensations, their ability to function improves, their avoidance goes down, and what's really encouraging, and these changes can actually happen relatively quick. So once someone is learning that, hey, these bodily sensations are just a sign, that my alarm system is activating,
Mhm.
they feel a lot more comfortable, and that world that was getting narrow can really just open up again.
So with cognitive behavioral strategies, so you give them a behavioral experience there, you get their heart racing, you get their breath kind of um, that fast breathing.
Yep,
And
exactly.
then you let them know you're not in danger. So it's kind of recalibrating their thought about the physical sensations. Do you also do some work to change their thoughts? Because I know some people interpret those sensations, exact sensations with a very similar context. Some people interpret it as I'm going to die, and some people interpret it as this is really fun. I'm very excited. And so do you also work with them about changing some of their thoughts about certain situations?
We do, and in fact, it can be so kind of challenging people's thoughts is one of the core approaches for cognitive behavioral therapy, and it can actually be somewhat easier for anxiety sensitivity than with other constructs, because it's a little bit more concrete. We can really talk with them. So, for example, a common fear that people have is when my heart is beating rapidly, I'm going to have a heart attack.
Hmm.
And we actually can really help them dispel that myth by providing some evidence to the contrary, which includes, for example, you teach somebody that their heart is when it beats rapidly, it's actually not a sign of a heart attack. And actually, one of the other pieces that sort of in my mind helps really solidify it is we let people know that in fact, people who have had a heart attack, they can easily distinguish between anxiety sensitivity and actually having heart problems.
Uh,
Um, And there's some things to consider here. If you had an individual who actually had heart problems, our first experiment would not be to mimic those symptoms. But
Mhm.
for everyday, normal, healthy people, who are not really likely to experience a heart attack, we can definitely engage with them and show them that a rapidly beating heart is just a sign of anxiety.
Do you have an example too from maybe I know you work a lot with people who have social anxiety. So just approaching somebody new can bring up those exact sensations, and they have a difficult time working through those sensations. They feel like I'm going to die if I have to talk with this person. Do you have some examples of how you change their thoughts or work through those feelings with them?
Yeah, and one of the things that's interesting about social anxiety is people often fear bodily sensations, but with social anxiety in particular, they also fear other people observing their bodily sensations.
Hmm.
And so, they can be afraid that, oh my God, I'm having this rapidly beating heart and I'm going to die. And that is going to seem, very catastrophic to them. And they can equally think, oh my God, I'm giving a speech in front of people and I'm going to be beat red and so embarrassed. And that is also going to be a catastrophe.
Hmm.
And so it's again another example of just showing people that these sensations alone are not harmful. And now, in the context of social anxiety, the way that we would probably start it is you would get them used to those sensations first outside of a social situation. But then it would be very important to have them also uh, demonstrate to themselves that when they have those sensations in a social situation, that they're able to cope with it.
Oh, that's great. That's great information. So if somebody who is maybe considering seeking treatment for that type of anxiety, they want to interact more, but it's terrifying to them to interact in social situations. So um, knowing that what they might get in treatment is a step-by-step approach to work through the experience of their own sensations and signs that they have, and their thoughts before you're going to throw them in that situation. And you would never throw somebody in that situation before they agree. They're going to practice and try it out.
Yep.
And
Yep.
what are typical thoughts somebody with social anxiety would say to themselves or experience?
So with social anxiety, a lot of the common thoughts are about other people judging you. So, I'm afraid I'm going to look like a fool in front of somebody. I'm afraid I'm going to say the wrong thing, or, I'm afraid they just don't like me.
Hmm.
Um, and with that, so those are kind of more common social anxiety types of symptoms. But along with that, those same people will think, oh, if I blush or if I tremble or if I look anxious in front of others, they're going to judge me. They're going to think less of me. And so it really, the big key in social anxiety is sort of this fear that others are going to judge you as inferior. And it with anxiety sensitivity, you can get the fear that they're going to judge you as inferior because of your bodily sensations, and then it can just kind of feed forward so that it really ramps up those bodily sensations, and you may turn from feeling afraid to give a speech to feeling like you're going to have a panic attack and you need
Hmm.
to immediately leave your classroom if you were
Hmm.
giving a speech in a class, for example.
Hmm. It's interesting too because while those are common thoughts that somebody with social anxiety would have, like they're gonna see this in me and they're gonna think less of me. My personal experience is that when you see somebody a little bit nervous when they're giving a talk, you're more compassionate towards them. You understand because you're just like them. They're just like
and
you.
and that actually is some of the so as part of one of our interventions we have a myth busting section, which is basically helping them challenge maladaptive thoughts, and that is exactly one of the myths that we bust. And with that evidence, there's actually research out there that shows that in general, when people see somebody as anxious, they do kind of empathize with them more.
Because we all feel it. We all have,
Exactly.
yeah. Okay,
Yep.
talk a little bit about, I'm going to get it wrong, intolerance of uncertainty.
Yes, one of my other favorite. So I didn't mention this earlier, but we call anxiety sensitivity and intolerance of uncertainty transdiagnostic constructs. And basically, what we mean by that is they are impacting a whole host of disorders, from substance use to suicide, eating disorders, insomnia, and of course, anxiety and depression.
Hmm.
And so, what intolerance of uncertainty is it's the tendency to respond poorly when you don't know exactly how something's going to turn out. Most of us don't like uncertainty, but for some people, it's a real struggle. So, they might do things like over prepare, they might seek endless reassurance, they might second guess every decision, or even avoid making decisions or avoid situations where they can't predict what's going to happen. So the catch, though, is I don't know if you're aware of this, but uncertainty is baked into our daily life, right? You can't eliminate it. And so when someone starts trying to organize their world around this idea of eliminating uncertainty, again, just like with anxiety sensitivity, their world gets smaller and smaller. Their decisions take longer, their stress levels go up, and everyday tasks that involve even mild unpredictable and unpredictability become exhausting. And so part of the reason for that exhaustion is the anxiety and anxiety sensitivity that can come along with that uncertainty. And so these two can really feed into each other. Someone can feel uncertainty about how they're going to perform on a test. And if they're very sensitive to that uncertainty, then they're likely going to experience elevated anxiety. And in turn, their body is going to react. And if they also happen to have elevated anxiety sensitivity, then they are just going to get even more and more ramped up until they reach maybe a point in their thinking where they have no choice but to either flee or freeze.
Wow. How common is that?
The overlap between anxiety sensitivity and intolerance of uncertainty is fairly common. I'd say probably uh, 50-60% of the people with anxiety that we see have elevated levels of both of them.
Hmm.
But also, what's interesting is sometimes what we see is people are very easily able to identify that they have a intolerance to uncertainty, but they might not even realize that they have an intolerance to anxiety until they start going through some of our work. So
Hmm.
we've had cases with people where they'll complete these self-report measures that are kind of measuring their anxiety sensitivity at the beginning, and they'll report almost no anxiety sensitivity. And then after we give them the first session, we see, oh, wait, their anxiety sensitivity has really peaked. And, first question would be like, oh, are we doing something wrong here? But when you talk to the people, what you hear from them is, oh, I didn't even realize that that's what this was. I didn't
Hmm.
even notice this cue between, something in the external world causing me a little bit of anxiety or distress, and then how my body was ramping up and causing me to withdraw or avoid or engage in other negative behaviors.
And I imagine the cognitive behavioral strategies are the same treatments for that intolerance of uncertainty, right? Is it the same treatment?
It's very similar. So again, cognitive behavioral therapy. Um, the approaches are a little bit, well, actually, it is similar. I guess one of the differences, so anxiety sensitivity, a lot of the times you can have them do it practice in the office and then practice at home. With intolerance of uncertainty, a lot of what you're trying to do in session, for example, if you're seeing somebody, is help set them up to identify experiments that they can try at home with that same goal of approaching uncertainty. And really, when they approach uncertainty, we're looking for one of two things to happen. One thing that can happen is they approached an uncertain event and they were sure this really negative consequence was going to occur. And when we have them engage in it, it just doesn't happen. The other thing that can happen is they approach an uncertain event. They're sure this really negative consequence is going to happen. Um, and it does happen. Now, you might think, well, that is no good. But actually, what it does is it usually teaches people that, oh, look, the worst possible outcome happened here, and I was fine. I was
Mm.
able to tolerate it.
How many sessions do people typically get, and how common is it that people will come in for help, or do they tend to be resistant to help? So how much treatment do they need, and how resistant are they to treatment?
Yeah, those are great questions. And actually, maybe questions particularly for these two constructs that we don't fully know. I know that we have been successful with relatively brief interventions. So we found, actually, in my graduate program, we did a one session computerized anxiety sensitivity treatment. And we were able to bring people's anxiety down. In relatively these large portions. So they would move from somebody who's sometimes or always afraid of these sensations to a little to sometimes afraid of these sensations. So even with one session, you can make some big changes in anxiety sensitivity
That's great
and
news. Yeah.
intolerance of uncertainty.
Hmm.
Um, One of the things that we've been testing is an intervention we call improve, and that stands for intervention managing psychological reactions to overwhelming emotions. And so in that treatment, we have a module targeting anxiety sensitivity and a
Hmm.
module targeting intolerance of uncertainty. And then
Hmm.
we have a final module where we walk them through the progress that we've made.
Okay.
And we've tested this. We've been testing it a lot in populations of people with comorbid substance use problems,
Hmm.
essentially because, like I talked about, people with anxiety will turn to avoidance. One of those avoidance approaches can often be substance use, particularly because some substances are actually help reduce their anxiety in the moment,
Hmm.
not long term, but in that moment. And so we have actually had some really good success with our 3 session intervention. And at least from the focus groups, people that we've talked to, 3 sessions seems to be fairly adequate for somebody who's struggling with elevated anxiety sensitivity.
Yeah.
I will say there are longer treatments that can be used. So we have a treatments for panic disorder that are 8 sessions,
Okay.
which can be used if somebody has a more severe sensitivity to anxiety. And then
Okay.
there is a generalized anxiety disorder workbook out there that is a 12 session intervention that is really focused on intolerance of uncertainty. And so it's almost to some degree taking our brief treatment and really just stretching it out. And really the idea is, and we're at a time where we're really trying to, perfect this personalized medicine. So, the way that I think about it is if we can come up with a way to get people in these brief ones, see if they've responded, and then we'll have a better idea of, like, how many people just need a kind of brief window into what these constructs are versus they need some more intensive actual therapeutic experience.
Yeah, this is excellent. It's excellent news for anybody who's listening who does feel, who dreads that feeling of anxiety, or is really uncomfortable with things being uncertain. There are efficacious treatments. There are brief treatments, so you don't have to be in treatment for a year. You could either feel improvement after one session or 3 sessions, or if it's more persistent, 8 to 12 sessions. So I think that's excellent news. I'm really glad you were here with us today on Choosing Help, Dr. Allen. If anybody is interested in more information about his work, he can be contacted at Ohio State University or the Ohio State University if you happen to live in Ohio. Or you can contact us there's a resources tab at our website, choosinghelp.com, or you can contact us at choosinghelp.com. And thank you for being with us today.
Yeah, thanks for having us.